Bismillahirrahmanirrahim. Welcome to my YouTube channel. Myself Farwa. Today's topic is about hemorrhage or bleeding. Hemorrhage, also known as bleeding, in the loss of blood from the circulatory system or the escape of blood from the blood vessels into the surrounding tissues. Bleeding can be internally and externally or visible. Internal bleeding, blood leaks from blood vessels inside the body, such as the liver or spleen. While in external bleeding, blood leaks from blood vessels either through a natural opening, such as the mouth, ear, nose, vagina, or anus, or through break in skin. In internal bleeding, the patient may notice blood either in the urine or stool. Hemorrhage continues as long as the vessel remains open and the pressure in it exceeds the pressure out of it. Hemorrhage can occur from the artery or arterial hemorrhage, vein or venous hemorrhage, capillary or capillary hemorrhage. A healthy person can endure a loss of 10 to 15% of the total blood volume without any serious medical difficulties. Excessive bleeding can be fatal and lead to several complications and can result in organ failure. The American College of Surgeons break hemorrhage is broken down into four classes. Class 1 hemorrhage involves up to 15% of blood volume. In this type, there is no change in vital signs and there is always no need for fluid resuscitation. Class 2 hemorrhage involves 50 to 30% of total blood volume. At this stage, the body may start to look pale and to be cool to touch. The patient may exhibit different changes in behavior. Blood transfusion may not be required. Class 3 hemorrhage involves loss of 30 to 40% of blood volume. At this stage, the patient's blood pressure drops, heart rate increases, and mental status get worse. Fluid resuscitation and blood transfusion are usually necessary. Class 4 hemorrhage involves loss of blood volume greater than 40%. At this stage, the limit of the body compensation is reached, and aggressive resuscitation is required to prevent death. Hemorrhage can occur in any part or tissue in the body, and each one has its own specific name. In the upper head, bleeding may occur in the skull or intracranial hemorrhage, in subarachnoid space or subarachnoid hemorrhage, within the brain tissues or intracranial hemorrhage. In the nose, we have a nosebleed, also called as epistaxis. In the mouth, there may be tooth eruption, losing a tooth, vomiting fresh blood, or hematemesis. Coughing up blood from the lungs is hemoptysis. May be pulmonary hemorrhage in the lung. In the urinary tract, there may be blood in the urine from urinary bleeding. Is also called as hematuria. Bleeding in the anus can result from upper gastrointestinal bleeding or melena, or lower gastrointestinal bleeding, hematochezia. Vaginal bleeding includes postpartum hemorrhage, breakthrough bleeding. In the gastrointestinal tract, there may be upper or lower gastrointestinal bleed. Variant bleeding may also occur. Causes: hemorrhage can result from traumatic injury to a blood vessel, underlying medical condition, or both, including cancer, surgery. Bile hemorrhoids, liver disease, acute bronchitis, and open wound. Low platelet count, menstrual problems, hemophilia, hypovolemic shock, fracture, and threatening miscarriages. Peptic ulcer, animal bite, medications, and aneurysm. Signs such as car accidents, heat wounds, false explosions, ectopic pregnancy, broken bones, heart attack, diabetes, and a chronic high blood pressure. Diagnosis: external bleeding can be diagnosed just by looking at the site of bleeding. Internal bleeding is commonly diagnosed by an imaging test. Treatment: treatment may depend on the cause or severity of the bleeding. Thank you for watching our video. Please subscribe us, like us. Allah Hafiz. Bye bye.